Hi, my name is Abillio Fon. I'm a final year student at LECOM School of Pharmacy. I'll be sharing with you today on how to manage hypertension, especially among the elderly population. These are my objectives. By the end of this presentation, you should be able to identify normal blood pressure values, use appropriate blood pressure measurement techniques, list the risk factors for the development of heart disease and stroke, list common signs and symptoms of high blood pressure, educate clients on high blood pressure prevention and lifestyle modification, describe medical management of hypertension. Before we go further, it is important that we understand what blood pressure is and what it does. Blood pressure is the force of blood pushing against the walls of blood vessels, usually arteries, as the heart pumps blood into the body. Blood pressure measurements are usually recorded in two parts. There is the systolic blood pressure, which is the blood pressure as the heart pumps blood into the arteries. And then there is the diastolic blood pressure, which is the pressure of blood when the heart is relaxing or resting. So, for example, normal blood pressure in adults is written as 120 over 80 millimeters of mercury. That means the systolic blood pressure is 120 and the diastolic blood pressure is 80. The table showing blood pressure values in adults with normal blood pressure and those with hypertension. As you can see, those with normal blood pressure have systolic blood pressure less than 120 and diastolic blood pressure less than 80. Now, if a patient's systolic blood pressure increases to 120 and slightly above, then we classify the patient as having elevated blood pressure. Also, if the diastolic blood pressure increases to 80 and slightly above, then we classify the patient as having stage 1 hypertension. On the other hand, if the systolic blood pressure increases to 130 and slightly above, we also classify the patient as having stage 1 hypertension. If the systolic blood pressure increases to 140 and above, then the patient has stage 2 hypertension. The same with diastolic blood pressure. If it increases above 90, then the patient has stage 2 hypertension. It is important to note that improper measurement technique can also contribute to faulty results, as a person's blood pressure fluctuates from high to low throughout the day as they experience different situations. We're going to see in the next slide how to properly take blood pressure measurements. The first thing to do prior to measuring blood pressure is to make sure that the patient is still and relaxed. Make sure patient has not consumed coffee or any drink containing caffeine or smoked cigarette at least 30 minutes before measuring the blood pressure. Ensure that the patient takes at least 5 minutes rest with back supported and feet flat on the ground before taking the measurement. Make sure the patient's bladder is empty, as a full bladder will give faulty result. And also make sure patient's arms are well exposed. Uh, have the patient put their arms on the table at the level of the heart. Then it's recommended to take 2 readings, one in the morning and one in the evening. In the morning, you can take readings before breakfast or before taking any medication, because there are some medications and the food that will cause blood pressure to abruptly increase. And also make sure to keep daily record of blood pressure readings. Many patients with hypertension also have other risk factors for heart disease. These are things that could increase a patient's risk of developing heart disease if they have hypertension. Now we have modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are those factors that can be changed, and if changed, will go a long way to reduce the risk of developing heart disease. For example, we have high cholesterol, overweight and obesity, physical inactivity, cigarette smoking, unhealthy diet, and diabetes. And then we also have other factors called fixed risk factors. These are factors that cannot be changed, or even if they are changed, they will not reduce the risk of developing heart disease. For example, we have family history. These are patients born with gene or a combination of genes that affect blood pressure Then we have obstructive sleep apnea, so difficulty falling asleep or difficulty uh, waking up after sleeping. Then we also have increased age as patients grow older. They have a greater risk of developing heart disease. Then we have now let's talk about the signs and symptoms of hypertension. How would you know a patient has hypertension? Often, hypertension does not show any signs and symptoms. That is why it is often called the silent killer. However, some patients will experience things like headache, nose bleeding, fatigue, or confusion. These signs may be showing a severe case of hypertension or they may be indicating something else. The best way to diagnose hypertension is to take blood pressure measurements. Now, there are some severe cases of hypertension that require emergency intervention. This is when blood pressure rises to around 180 over 120. When you see such a reading, it is advised that you take the blood pressure measurements again about 5 minutes later in a different setting. And if the pressure still stays around that numbers, then you should follow your emergency protocol, which may include contacting or calling 911. But in most cases, when you notice that a patient has high blood pressure, then you should contact the physician because it is only the physician that can diagnose a patient with high blood pressure. And usually, proper diagnosis is to take the average of 3 blood pressure readings in 2 different hospital visits. Lifestyle modification. These are practices that have been proven to prevent and treat hypertension. These include weight loss. Studies have shown that obese patients who lose 1 kilogram of body weight also lost 1 millimeters of mercury of blood pressure. We also encourage physical activities like running and walking. If a patient can run or walk about 90 to 150 minutes a week, they can reduce their blood pressure by about 5. Moderate alcohol consumption is also encouraged. If somebody who consumes alcohol can reduce their alcohol intake to say less than 2 drinks a day for men and less than 1 drink a day for women, then they can reduce their blood pressure by about 4. Now there's also the DASH diet, which is very important. This is food that are rich in whole grains, fruits, vegetables, and low-fat dairy products. This DASH diet has been shown to reduce blood pressure to about 11 millimeters of mercury. We also encourage reduced sodium intake. As people become older, their bodies become more sensitive to salt, and we know salt draws water into the bloodstream and causes blood volume to increase, and that also increases blood pressure. We also encourage increased potassium intake. This can be done by eating food or diet that are rich in potassium. This can also go a long way to reduce blood pressure. Normally, lifestyle modification alone is sufficient to manage mild hypertension, even up to stage 1 hypertension. Sometimes, lifestyle modification alone is not helpful in reducing blood pressure. In that situation, then we will add medications. These are usually situations where blood pressure persistently stays above 130/80, or if patient is taking other medications that have been known to increase blood pressure, then we will add medications in that situation. Okay. These are classes of medications that are normally used to treat hypertension. First class of drugs are called diuretics, or simply water pills. These drugs act on the kidneys to remove excess water and salt from the body. There's another class called angiotensin converting enzyme inhibitors. These ones prevent formation of hormones that narrow blood vessels. Then there's another class of drugs called angiotensin receptor blockers. These ones also prevent formation of hormones that narrow blood vessels. Then another class of drugs are called beta blockers. These ones make the heart beat slower with less force, and this also reduces blood pressure. Then the last class that we're mentioning here are called calcium channel blockers. These ones keep blood vessels relaxed so that blood can flow easily and cause the pressure to go down. There's some side effects of these medications that we need to look out for. Some of the common side effects include upset stomach, constipation, diarrhea, vomiting, dizziness, headache, cough. Then there are some side effects that are very rare but serious. These include angioedema, where you might see patient's face swelling, mouth swelling, throat swelling, and other areas. And then, so the common side effects are usually not very serious because they come and go away. But if they persistently stay or do not go away, then you should contact the physician. Also do not discontinue a medication without contacting the physician first. Okay, to conclude, hypertension places patients at an increased risk for heart disease and stroke. As healthcare professionals, knowledge of the risk, causes, and effects of hypertension is important for proper patient care management. Healthy lifestyle behavior is the best way to reduce the risk of high blood pressure and reduce the need for costly blood pressure medications. If hypertension cannot be managed with lifestyle modifications, then we include medications. Okay, these are resources where you can find more information about blood pressure. And again, thank you for listening. Have a great day.